When dealing with an individual who has lower back pain, you may find that it is helpful to quantify or put an objective number to the strength or the endurance of the muscles that surround the lumbosacral spine. And so when we look at these measures, we think of these as performance tests, muscle performance tests, and these are oftentimes not assessed on day one, just because many of our patients do have a little bit higher irritability, severity. They're a little bit more aggravated when they first come to the clinic. However, there may be a time where it's appropriate to look at these. As such, these are often incorporated then later in the plan of care and used as a benchmark to track progression. And there are three that we're going to look at today. The first is a Behring-Sorensen test, which looks at the endurance of the extensors. The second is a flexor endurance test, which looks at kind of your anterior aspect of your flexor musculature. And then the third is a side-lying test that really looks at the more kind of frontal plane and transverse plane stability. And so let's go ahead and get started with these. For the Behring-Sorensen position, we're going to ask our patient to come into a prone position. Their head is going to be at this end of the table. So we're going to have them spin around here. And then their arms are actually going to be on this stool right here in front of us. Now, I am specifically using a rolling stool because what we need to do is we need to get our patient's ASIS right at the edge of the table. So by having this rolling stool, we can bring our patient forward a little bit here. There we go. And then it allows us to kind of set him up. Now, at this point, the setup of the test goes like this. We're going to ask our patient to lift off of this chair momentarily. In doing so, we need to stabilize the legs. Now, you have two options here. Either you as the therapist can do that, or you can use a belt or some other form of restraint system. For today, I'm going to be providing the counterbalance here, and we'll show you the setup, though not the entire test to exhaustion. So for this, I'm going to come right next to my patient. We're going to bring the legs together, and then I am going to counterbalance kind of right midline or kind of mid-muscle belly of the hamstrings. When the test is ready to go, our patient's going to cross their arms across their chest and lift their arms off of the stool. When you're ready. We then would ask them to hold this position until they lose kind of the neutral position of the lumbosacral spine. When they fatigue, the test is over. Go ahead and relax. And they would assume their starting position by putting their arms back on the stool. It's a fairly fatiguing test, not only for the patient, but also for the physical therapist. So ensure that you've screened your patient proper and you recognize that they are appropriate for this assessment. The next is just the opposite of this, and that's the flexor endurance test. And so we're going to ask our patient to come up. Assume a hook-lying position here on the table, so your feet can be down here, head up here. And go ahead and bend the knees up for us. Okay? Now at this point, here again, we can stabilize, all right? But what we want to do is we want to ask our patient to come up as if they were to do a sit-up and grab their knees to start with. So go ahead and come on all the way up, okay? And then what they're going to do is cross their arms across their chest, and we're going to have them decline back to approximately a 45-degree angle, so right there, right? Now at this point, we're going to start the timer. And so you can see the individual is kind of holding in a mid-range position, and as soon as we start to see the individual fatigue, they begin to either have to come into a more of a flex position, or they hunch over, or they begin to fall back. The test is going to end. Go ahead and relax, right? Now, for this, we really want to see about a 1-to-1 ratio between the flexors and the extensors that were assessed in the Behring-Sorensen test. And so if we see kind of this ratio that is off balance or off kilter, that might be an area where we begin to focus interventional care to address that. The last piece now is a side-lying test. And so for this, we're going to ask our patient to rotate onto their side. In essence, this starts to look a lot like a plank position. We're going to bend the knees back here, and we're going to bring the pelvis forward such that from the lateral knee through the hip all the way up through the shoulder is a nice straight line. All right. Now in this position, what we're going to ask the individual to do is to prop up on their elbow. Good. And then lift their hips up off the table. And so this then begins the test. We're going to have them hold on to the hip right here as a standardized position. And again, we're going to start the timer. Now for this test, really the comparison is right to left. Okay? And so again, we're looking for a ratio of approximately 1 to 1 such that there is balance and symmetry here. As soon as the individual either begins to rotate, begins to lose the position, or just complains of onset of symptoms and self-limits the test, that's when you would stop the timer. Again, can be performed to both sides. So, go ahead and relax. Have a go with each of these 3 muscle performance tests and measures. Bearing Sorensen in a prone position, flexor endurance in a seated position, and then finally our side lying test. Let me know if there's any questions.